Good afternoon, my name is Alexander Chibirev. I am a medical consultant in Neurosoft. Today we will consider the possibilities of electromyography application in dental practice. The main technique in this area is surface electromyography from the muscles involved in mastication. EMG is recorded from the masseter and temporalis muscles simultaneously from both sides to assess the symmetry of their work. For this purpose we need a 4-channel amplifier and surface withdrawal electrodes, a cup electrode or solid gel adhesive electrodes, which are connected using an alligator connector. First, let's create a new examination. Select the Mastication Activity Test template. There are 2 templates available, one for the occlusion study and one for the mastication study. Let's start with occlusion. There are various recommendations for placing electrodes on the masticatory muscles. The basic principles are that the active electrode is placed on the abdomen of the muscle and connected to the negative input of the amplifier channel. The reference electrode is applied 2 cm from the active electrode and connected to the positive input of the amplifier channel. The ground electrode can be applied to the patient's forehead, chin, or an electrode tape can be used. The first channel of the amplifier corresponds to the right temporal muscle. The second channel corresponds to the left temporal muscle. The third channel corresponds to the right masseter muscle, and the fourth to the left masseter muscle. As a grounding electrode, we will use a tape electrode. In the neuromep.net software, there are 2 types of examination. This is EMG recording from the chewing muscles, as well as a similar test with the use of cotton rolls to standardize the results. The cotton rolls are placed on the first and second molars of the patient. By default, the software selects the basic test mode. This means that the registration takes place with cotton rolls. Ask the patient to clench his teeth as hard as possible and register for 5 seconds. Save the data. If necessary, the registration can be repeated. Ask the patient to clench the teeth again and record for 5 seconds and save the data. Remove the cotton rolls and let the patient rest for 2 minutes. In the software switch, the recording mode to maximum force, which means recording without cotton rolls. Ask the patient to clench the teeth again and record for 5 seconds. Save the results. The recording can also be repeated if necessary. Ask the patient to clench the teeth again. Record for 5 seconds. And save the results. At the end of the registration, we receive data in the form of various asymmetry coefficients of the graphical representation of the mass of the occlusal center of the mandible and pie charts that reflect the work of the chewing muscles. For details on interpretation, see the link in the description. To assess masticatory movements, we will use the mastication test template. Ask the patient to chew a hazelnut first on the right side and save the results. Then ask the patient to chew a hazelnut on the left side and save the results. In this way, we evaluated the work of chewing muscles during maximal occlusion and during masticatory movements. That's all for now. Thank you for your attention.